Today's video is about amenorrhea, that is absent, suppressed or delayed menses. Its possible causes, common signs and symptoms, and how holistic remedies can help. Read the disclaimer, and if you are interested in such health-related informative content, make sure to follow our channel, subscribe, like and press the bell icon. Menstruation is an important activity of women's reproductive function. Having a regular menstrual cycle is essential to have a healthy uterus and a sign that the woman's reproductive system is working normally. A uterus that is not stimulated to shed the endometrium, or sheds the endometrium inadequately, may become atrophied or shrunk. This means the muscles lose their tone and strength. If the mucosa lining is not stimulated to secrete mucus, then the uterus is not lubricated and may become dry or weak and would not be the best environment to house an embryo. The term amenorrhea literally means an absence of menstrual bleeding, often defined as missing one or more menstrual periods. There are two types. Primary refers to the absence of menstruation in someone who has not had a period by age 15. Secondary refers to the absence of 3 or more periods in a row by someone who has had normal periods in the past. If you don't have periods for 3 to 6 months, you must consult a doctor. Most common condition associated with amenorrhea: headaches and vision problems, increased facial hair and general hair loss, vaginal dryness, heat flashes or night sweats, disturbed sleep, marked weight gain or weight loss, anxiety, decreased sex drive, acne, pimples, nausea, vomiting, heavy breathing, laziness, tiredness or always sleepy, bleeding from the nose or the anus, milky fluid or discharge from breasts, changes in breast structure, heart palpitation, legs feel heavy, further complications if left untreated, infertility and problems with pregnancy, miscarriage risk or problems if pregnant, psychological stress, osteoporosis, weakening of bones and cardiovascular diseases, constant lower back or pelvic region pains. An effective holistic approach is to identify and treat the causative factors. Possible causes of absent menses: polycystic ovaries, pelvic inflammatory disease, chromosomal or genetic problems, premature ovarian insufficiency or early menopause, an injury to the reproductive organs, such as cervical stenosis, lack of reproductive organs, if the female system didn't develop fully. A membrane or wall may be present in the vagina that may block the outflow of blood from the uterus and cervix. Conditions such as diabetes or celiac disease. Nutritional deficiency, e.g. iron deficiency, anemia. Obesity or being underweight. Having an eating disorder, such as anorexia or bulimia. Excessive exercise or rigorous training. Mental stress, severe emotional turmoil, fear, anger, frustration, trauma, bereavement, grief or fight, etc. Psychotic disorders, mania, delirium, hysteria. Disappointment in love, relationship. Use of certain medications. Drug addiction or intoxication. Exposure to cold water, chilly weather. Hormonal imbalance such as elevated levels of follicle-stimulating hormone. When hypothalamus, a gland in the brain, slows or stops releasing gonadotropin-releasing hormone, the hormone that starts the menstrual cycle. Thyroid malfunction, whether an overactive or underactive thyroid. Excess levels of prolactin, a hormone that naturally rises during pregnancy to stimulate milk production. A non-cancerous, benign tumor in the pituitary gland. Disorder of the adrenal or the ovarian glands. Natural causes, such as during pregnancy, breastfeeding, menopause, use of contraceptives, activities and lifestyle changes to induce absent menses, reduce workload or other stressors, if possible. Regular check your weight to control obesity. Spend time with friends and family. Engage in an enjoyable hobby. Using meditation or mindfulness techniques such as yoga and deep breathing. Reduce exercise if you overdo. Missing periods may occur due to low energy availability. This can occur if you aren't taking in enough energy relative to the energy you're burning through exercise. Take steam or sitz bath in the morning and in the evening. Sit in a tub of hot water for 10 to 15 minutes. A warm bath may help relax tight muscles and relieve emotional stress that can help to bring on your period. You may add relaxing essential oils to a bath. Try using a warm compress such as a hot water bottle by applying it to the abdomen, as heat may help increase blood flow, thus gently accelerating the menstrual cycle. Lower pelvic fertility massage. It aids the body in regulating menstrual cycles. Promotes hormonal balance. Helps to reduce stress and stress hormones. Improves communication within the endocrine system. Increases circulation to the uterus, ovaries, and fallopian tubes. Promotes the movement of fluids. Helps the body to rid itself of old stagnant blood and tissues. Herbal supplements and home remedies to support regular menstrual cycle. Make sure to avoid any ingredient you are allergic to, discussed in this video. Top foods that may help make your period come faster. Pineapples, a rich source of bromelain, an enzyme believed to affect estrogen and other hormones. Eat dates to induce periods before the due date. Sesame seeds 2 times daily, a week before your periods until your periods arrive. Parsley leaves tea may help to stimulate uterine contractions. To make parsley tea, simply pour a cup of boiling water over a couple tablespoons of fresh parsley and allow it to steep for about 5 minutes before drinking. Avoid parsley if you are pregnant, nursing, or have kidney problems. Ginger is believed to cause uterine contractions that stimulates menstrual flow, resulting in promotion of menstruation. In delayed periods, a combination of parsley and ginger tea is recommended, or take 1 tablespoon of ginger juice mixed with 2 to 3 tablespoons of jaggery. Turmeric is supposed to work by affecting estrogen and progesterone levels. Boil a spoon of turmeric in a glass of water or milk and consume it twice a day, probably 10 days before your expected date. Also, consume more coconut and olive oils, nuts and seeds, wild-caught fish, probiotics, bone broth, bananas, peaches, pomegranate, sugarcane juice, carrots, celery, apple cider vinegar, papaya, curd, rice, avocados, spinach and jaggery, and fermented vegetables. Milk with cinnamon at bedtime. Top essential oils for irregular periods. Aromatherapy is the use of plants' extracts for healing. Always dilute in a base oil like olive oil, etc., and apply externally. Clary sage essential oil helps regulate menstrual cycle and balance your hormones. Lavender, massaging lavender oil onto your abdomen can help to relieve menstrual cramps and also help to balance your mood during this time. Geranium, sweet, harmonizing oil, has been used since ancient times for regulating menses. Homeopathic approach for absent menses. Homeopathy, one of the safest holistic system of medicines that offers a unique, personalized treatment and has the potential to reverse a medical disorder. Consult a qualified homeopath for a proper assessment and take tailor-made remedies as per your causative factors, modalities, and peculiar signs and symptoms, etc. Here are top 10 homeopathic remedies for missing periods. 1. Pulsatilla. 2. Apis mellifica. 3. Calcarea carb. 4. Calcarean fars. 5. Senecio. 6. Gossypium. 7. Silicia. 8. Lachesis. 9. Sulfur. 10. Thyroidinum. Thanks for watching. Avoid self-medication even with natural remedies. Or contact our holistic health clinic in Birmingham for your specific, tailor-made remedies as per your peculiar signs, symptoms and causative factors. Bye for now and talk to you soon in another video.